Please while I confirm your passcode. Your PIN is confirmed. The host has placed the meeting into listen-only mode. Please enter your personal identification number or PIN, followed by the pound or hash key. Tone, you will be the 147th person to join the meeting.
And so just don't be scared. It's a good word, and we're going to teach you more about it. Other responses that we got a lot of responses about lack of funding as a major barrier to policy development. Others said
you are now muted.
Said that it's really difficult to get buy-in from local decision makers or stakeholders on obesity prevention policies. Others noted that it was really difficult to collaborate across agencies and organizations that have different functions. And many of you made statements along the lines of not knowing where to devote your resources. As one participant online from a small community in Washington State put it, the biggest barrier is simply knowing where to start. Health Law and Policy, the sponsors of today's webinar, we work with advocates and policymakers like all of you on all of these issues that you've listed in response to our questions. But we obviously can't address all of those issues on one 75-minute webinar. So we're going to tackle that last one. How to identify and prioritize strong obesity prevention policies for your community or state. Before we get into answering that question, though, I want to introduce my colleague Heather Wooten, who will take us through some housekeeping announcements and let you know how you can interact with the speakers on today's webinar.
Christine, hopefully everyone can hear me. My name's Heather, and as Christine mentioned, you've joined Crafting a Strong Obesity Prevention Policy in 8 Easy Steps. And today's webinar is being produced by Public Health Law and Policy and sponsored by NPLAN, which is the National Policy and Legal Analysis Network to Prevent Childhood Obesity. So this webinar is going to be a little bit non-conventional. Rather than having one long presentation with one speaker or some short presentations from a variety of presenters, we're going to explore today's topic through a conversation. So Christine Fry is going to walk you through those 8 elements for a strong policy, and she'll be providing explanation and stories as we go. I'm going to facilitate the conversation, and I'll also be our resident skeptic. And Charlotte Dixon from the California Center for Public Health Advocacy, who I'll introduce shortly, will jump in from time to time with additional stories and wisdom from her extensive work with California elected officials on public health policy. So here's a bit about Public Health Law and Policy. We're a national nonprofit that works with community leaders and policymakers to implement creative legal and policy strategies that improve the public's health. Now that you know a little bit about us, let's take a look at everyone who's participating today. So you're joined today by participants from across the country, and in fact, we have over 1,000 people registered for this webinar. So I think that's a great sign of the excitement and interest in your colleagues in this issue across the nation. Time for a little bit of housekeeping. If you have technological difficulty at any point during the webinar, please contact Scott Watkins. The best way to reach him is using email, and you'll see his email up on the screen here. You can also use WebEx chat, which I'll explain shortly, to contact him with any questions related to IT. So during the presentation, if you'd like to ask a question or make a comment to all attendees, please use the chat box. Let's take right now to just open the chat box up and give everybody a chance to use the technology. So I'd like everybody to tell here, what's your favorite spring veggie? People put their answer in. Hopefully we'll all be able to see while we're looking forward to eating this spring. Use that box at any time during the presentation to ask or respond to questions from the presenters or other attendees. And following the discussion, we'll answer your questions. Finally, here's a reminder that this webinar is being recorded. You'll receive a link to the recording after the webinar, so you could again or send it to your colleagues. You'll also receive a link to fill out an evaluation survey. Let us know what you think. Your feedback is really important to us. Our idea for today is to walk you through the 8 elements to consider crafting a strong obesity prevention policy. Chris, who you've all heard from so far, will be our guide. She'll take us through each step and give examples. Christine?
This is my voice.
And we're also very fortunate to be joined by Charlotte Dixon from the California Center for Public Health Advocacy. She's the Director of Local Policy and the Director of the Healthy Eating, Active Living Cities campaign. In these, she's worked with numerous communities around California to implement local obesity prevention policies. She will provide comments throughout the presentation based on her extensive experience. Charlotte?
Hey, everybody, and I just wanted to add a couple things. One is that I have been working on local policy for many years, beginning as a community organizer in public housing in Boston, Massachusetts, and then moving on to work in neighborhood-based campaigns in Waltham, Massachusetts. And from there, I moved to California and have worked on policy out of the Health Department in Contra Costa County, and now out of California Center for Public Advocacy and the League of California Cities. So I bring the different perspectives that I think all of you are bringing in terms of your policy work. I also just wanted to talk a little bit about California. California is big. Some cities are very progressive, but most of its cities are small, under 100,000, and most of its cities are like all the cities that you are working in. You have regular local folk elected as council members want to do something to improve the community. So I do think there are a lot of parallels here between the kind of work we're seeing around the state of California and what you're doing in your communities around the country. So thanks so much for having me.
And you'll recognize my voice by now. I hope this is Heather. My job is to facilitate this discussion and ask questions as we go, including questions from all. And I see you're all figuring out how to use our chat and Q&A box. I see a lot of people responding with asparagus, which is one of my favorite spring veggies. Now, I also wanted to say we do have a disclaimer here because I work with lawyers. We have some fine print. So the information that's being provided in this seminar is for informational purposes only. It does not constitute legal advice. Public law and policy does not enter into attorney-client relationships. And here's Christine.
My favorite is Brussels sprouts, by the way. By the end of this webinar, though, you'll know a lot about not just spring veggies, but what a strong obesity prevention policy looks like. And so you'll know it when you see it. Now, before we dive into the 8 easy steps or the 8 elements, I want to do some definitions here. I've got questions recently about what I mean by an obesity prevention policy. For the purposes of today's discussion, we're talking about state or local policies. Some might work on internal organizational policies like workplace wellness policies. We were talking about these today, even though they are an important part of the obesity prevention puzzle. We're focusing on policies created by elected officials or government agencies. In general, there's a diverse array of obesity prevention policies that people are working on right now across the country. They do at least one of 3 things. They make it easier to buy, make, or grow healthy food. Make it harder to buy junk food. They make it easier to be physically active where you live. Overall, the goal of any obesity prevention policy is to change the environments where people live, work, and play. These policies make the healthy choice the easy choice. Think about your current location, where you're listening to this webinar. If you stepped out the door right now, would it be easier for you to find a store selling fresh fruit or a place selling a hamburger and French fries? Like inside of my office right now, it would be way easier to find a hamburger than it would be to find a fresh piece of fruit. There's a hamburger joint right behind our office. Obesity prevention policies aim to change our environment so that it's easier to walk out the door and find healthy food as compared to unhealthy food. Public health law and policy, we have been providing legal and policy technical assistance to obesity prevention advocates and policymakers around the country for several years. We took a step back from our community and state work to distill the lessons we learned about strong obesity policy into 8 elements or criteria. You apply these criteria to the obesity prevention policies that you're considering in your community, and of course, use them when you're crafting new policies. So without further ado, let's dive into the 8 elements of a strong obesity prevention policy. You need to ask whether or not the policy is actually a policy.
I have to jump in here. This is Heather. Is this really a step? Don't we all just know a policy when we see one?
It's really common for very smart, savvy people to mix these two things up, policies and programs. And if our audience knows the difference, your colleagues might not. So it's your job to help your colleagues turn good ideas into good policy ideas. So a good example of what we mean by policy. Have you ever been to Fresno, California?
I have. Fresno is one of the cities in California's Central Valley.
And what do people do in Fresno?
Like much of the Central Valley, Fresno County's big industry is agriculture.
That's right. Most of you on this call today probably eat a lot of food from the Fresno area during the winter months. The city of Fresno is in one of the world's most productive agricultural regions. At the time, though, residents of Fresno have some of the country's highest rates of food insecurity. Yet, until recently, starting a farmers market in Fresno was actually illegal. As interesting as that sounds, Fresno's zoning code, which determines how land is used throughout the city, didn't find farmers markets. So getting approval to establish one was practically impossible. As a Fresno Green Strategy launched on Earth Day in 2007, advocates and policymakers worked together to amend the zoning code to define farmers markets and allowed them in commercial and residential zones. It created the opportunity for fresh produce to be made available in neighborhoods where it's needed most. This is an example of policy change. By the zoning code, the city created an environment that is conducive to making the healthy choice the easy choice. This Fresno made it possible for farmers markets to sprout up all over the city.
Wow, that's a great success story, but I'm not sure if I could write a definition of what a policy actually is.
Okay, so what we mean by policy is a law or regulation that is binding and widely applicable. Policies set the context for widespread change. They create the conditions in which programs and initiatives, both public and private, can emerge and flourish. So everybody on the line right now to think about this question. What example of a program or initiative that can now flourish as a result of Fresno's farmers market zoning policy change?
You may think about a program that's really gaining traction in communities around the U.S., like Detroit's Double Up Food Bucks program, which provides a match for purchases at farmers markets by low-income shoppers who use their food stamps or SNAP benefits. That kind of program is possible when you have a farmers market-friendly policy in place. Okay, let's talk about element number 2, which is legal feasibility. Can you tell us what this means and how our audience can tell if a proposed policy is legally feasible?
Of course, that's why I'm here. So generally speaking, when we think about legal feasibility, we think of it in 2 ways. First, a city or county must have the legal authority to pass a particular public health policy. This authority ultimately comes from the state because local government is a creature of the state. Different states provide different levels of authority to their city and county governments. Now, let's say your community does have the legal authority to pass a public health policy. This question still arises of whether a policy proposal raises other legal problems, like First Amendment violations or liability concerns. Challenged in court, most basic business and land use regulations would be subject to, and this is a legal term of art, but it's a good one to know, rational basis review. It's basically a smell test. So when you hear the word, you can think of this little puppy here. Does the government have a plausible reason for enacting the law?
Okay, that's helpful, but some policies just sound illegal. For example, an ordinance that bans new fast food restaurants, or an ordinance requires grocery stores to have candy-free checkout aisles.
You're saying laws do sound illegal. Sometimes policies that sound illegal are just politically edgy. Those policies that you mentioned would have a good chance of surviving a legal challenge or passing the smell test, even if the political steps aren't aligned.
Another legal red herring that communities struggle with is liability. For example, some school principals are concerned about opening school facilities to the broader community for use after hours through joint use agreements because they think doing so will expose the school to additional liability. Sometimes just saying the word liability can stop a conversation about a potential policy.
This is a really common concern, and not just with joint use agreements, but also with policies that encourage walking and biking to and from school. We hear about it in the context of community gardens, in the context of bringing school garden produce into the school cafeteria. Liability is a really common word that's used in the obesity prevention world. Looking particularly at joint use agreements, for example, these liability concerns voiced by schools and school districts are very real and understandable. However, there are a lot of misconceptions about liability that can be cleared up with information about your state's liability laws and through clearly written policies.
And interested in learning more about liability and joint use agreements in your state, check out our 50-state scan of laws addressing community use of schools and our joint use primer on liability. We just heard an example of a policy that sounds illegal but may not be. What about those policies that sound really easy but do in fact raise tricky legal concerns? For example, we get a lot of questions about banning junk food billboards near schools. Is that feasible?
Sometimes policies that seem like no-brainers really do raise legal problems. For example, a city that wants to ban junk food billboards near schools will run up against significant First Amendment problems. It's important to know that even when a proposal isn't an easy win from a legal perspective, the story isn't over. The community might decide to try something that's legally untested and uncertain. The important thing is that the city attorney is prepared to defend it and has weighed the potential benefits of that policy against the risks that a legal challenge might result in case law that sets bad precedent for those who want to try something similar. But discouraged. So there are a lot of resources out there to help you navigate this legal feasibility issue. Public Law and Policy has tremendous resources on our website that demystify these legal concepts like liability and local authority. You can also always call on us to get answers to more specific questions. An important partner, just to close out this section, that I want to mention is you should really work with your city attorney or county council or even just a private local attorney who's knowledgeable about pertinent state and local laws. They are best positioned to help identify the legal risks for your policy ideas and ways to ensure success.
Let's take a look at the next element, financial feasibility. In a time when public coffers are shrinking, how do we pay for all these innovative public health policies?
We're definitely seeing this play out very publicly in Wisconsin. The reality is that every state and locality is in fiscal crisis. Prevention policies need to take this into account in one of three ways, which we'll go over in this section. Either they should require little to no public expenditure, capital and existing funding streams, or generate new revenue. And to kick us off, I think Charlotte has a good story about low or no cost policies.
So our campaign with the League of California Cities, which is called the Healthy Eating Active Living Cities, has had tremendous success during California's tight economic times because we focus on, quote, no and low cost policies. And this kind of soundbite, no and low cost policies, is one that our campaign advisors, a city council member in LA County, came up with. And early on in our project, when we were talking with our advisors, the issue of fiscal responsibility really came up. And this frame is one that we created. And so what are no and low cost policies? These are policies that can be implemented easily and are part of what the city is already doing. So, for example, I think some low and no-cost policies are vending policies, nutrition standards for foods that are served in city programs or at city events and meetings. The policy of prioritizing walking and biking in the capital improvement plan. All cities have to put other plans to improve the streets. So why not go ahead and put walking and biking in there? Complete streets policies. This can adopt a complete streets policy and begin implementation when funding is available. These are all examples of no and low-cost policies that cities and counties can get started on, knowing that it's going to take a while to implement this. Chris talked about involving the city attorney. I also want to put a plug in for involving your local elected officials. You can usually identify at least one champion on the council or on the board of supervisors or whatever policymaking body you have in your community. A champion help you frame the policy, including helping you figure out how to address the cost issue in a way that resounds with your local policymakers.
Charlotte just told a story about how city officials respond to this frame of no and low-cost policies and gave us some great examples of that. This is a powerful message in this economy. Now, turning our attention to the next type of financially feasible policies that use existing revenue streams can also be feasible. So the state of Oklahoma has done a really good job of this with recent corner store legislation. Come to Oklahoma. Oklahoma is not okay when it comes to nutrition. It has one of the highest adult obesity rates in the country, and it's also in one of the top 5 states when it comes to hunger rates. Based on statistics, it's not surprising that the Department of Health has classified more than half of the state as a food desert, which is a term used to describe areas with little or no food retail. Last year, Seneca Scott, a state representative from Tulsa, introduced a bill intended to turn Oklahoma's food deserts into food oases. The bill proposed opening up an existing state agricultural loan program to healthy corner store owners. Healthy corner stores were defined in the legislation as stores that market fresh fruits and vegetables and sell very little tobacco and beer. The program provides below-market interest rate loans to struggling farmers and other agriculture-related small businesses in the state. Signed this bill into law in April 2010, and as of November 1st of last year, healthy corner stores now have access to the loan program. When existing funding streams are used in new ways, everybody wins. Oklahoma's producers will likely see more outlets for their farm products. Core owners have an incentive to improve their offerings in order to access these dollars. And of course, the consumers win by potentially having access to healthy food in their neighborhoods. Not forget the legislators or elected officials. They win because they're making policy with broad impacts without spending a single new dollar. I should note that in Oklahoma, this legislation passed both chambers of the legislature unanimously, which is astounding in a politically divisive time.
So we've heard about low and no-cost policies, but some of the innovative policy strategies we work on do require some cash. Is there a way to pay for them?
Well, there is. Policies that generate revenue are another way to go. There's been, as you've probably heard, to pass soda taxes at the local and state level, and it's gained traction. Many of the soda tax bills being considered at the state level this year set aside at least a portion of the revenue for obesity prevention and public health efforts. An example that audience members from local government might be familiar with is impact fees. Some fees impose fees on developers that are earmarked for the creation of healthy features like parks and playgrounds. Just to recap, a strong obesity prevention policy should either be low or no cost, capitalize on an existing funding stream, or generate new revenue.
This is good, and I think a frame that we all should be using to address the cost of obesity policies is the cost of obesity and chronic disease to communities. My organization, the California Center for Public Health Advocacy, put out a report last year showing that the cost of overweight, obesity, and physical inactivity among California adults had risen to $41 billion. That's $41 billion. And I think that we as advocates should be putting out this kind of information. You would be surprised at how powerful this message is about the costs of obesity, overweight, and physical inactivity. In our project, Healthy Eating, Active Living Cities campaign, we found that city managers in particular are very interested in cutting the costs of health care, and they understand the relationship between obesity prevention and health care costs. To get in more specific, we found that city managers are interested in no and low-cost workforce wellness policies if they want to reduce healthcare utilization costs, absenteeism, increase in insurance premiums, and low productivity. And city managers who are responsible for the budgets of our cities understand that simple workforce policies can benefit their employees for whom they're paying health care premiums, and that community policies can benefit the employees' families. This link between health care costs are borne by the municipality, the township, the county. I think we can use this as an argument or the point that we make while we're talking about the cost of obesity prevention policies. The cost of health care is going to be higher.
Thanks, Jeff. Number 4 is all about implementation. So I've reviewed a lot of draft policies before, and they can be really fuzzy on this one.
Right. Sometimes policies are so vague that it's not at all clear what they're supposed to look like in practice. An example. In response to tragic car accidents involving pedestrians, 2 different cities in the U.S. introduced a complete streets policy. This is a policy that ensures that roadways are designed not just for cars, but for pedestrians, bicyclists, public transit users, and people of all ages and abilities. Let's take a look at the policy language from these 2 cities. Compare these 2. Which one do you think is stronger, top one or the bottom one?
Well, both of these reflect a commitment to complete streets, but none of them gives any direction about what is supposed to happen next in order to achieve that commitment.
The second one I think you're referring to much more specific. It tells the city to establish a steering committee to develop a complete streets policy, implement a sustainable complete streets program, and propose complete streets legislation. These are 3 concrete steps that will hopefully lead to complete streets in that city.
Yeah, generally, I agree with this point of view, though some of our policy language has to be vague. And that's, I'm contradicting and taking over Heather's role as skeptic. I think that because we're at the beginning stages of the conversation about obesity prevention policy, there may be times in our community struggle where we just need to get the conversation going. We need to bring the debate about obesity prevention policy as a solution to this epidemic into our public arena, our city councils, our county boards, into the media. And so sometimes vagueness around implementation serves that cause. It serves to get the issue out there. It serves to get the solution policy out there. And one example I'll use is that in our campaign we've had a lot of success with resolutions where cities adopt resolutions with policy goals related to obesity prevention. And I know that this is no substitute for policy, but it's a way to get the conversation started, and then we and our advocate partners at the local level are going back to the policymakers to say, you made this commitment, you said you would do this, now let's take the next step together. I just want to put a plug in for that sort of strategic decision that you might make around selecting vagueness in order to get the conversation going and in order to change the political context.
Element is really important. Craft policies that deal with health inequities.
Low communities and communities of color are plagued by high obesity rates and other health disparities caused by major inequities in the social determinants of health. Addressing these disparities is a core goal of the obesity prevention movement. So, obesity prevention policy will somehow take these disparities into account. The policy itself can either focus on disparities, or the implementation of that policy can ensure that resources are directed to the most underserved people. Let's look at in a real example. Policies that address disparities are often controversial. Los Angeles City Council imposed a moratorium on new fast food restaurants, not throughout the whole city, only in South Los Angeles, which is a food desert where people's options for daily nourishment consist primarily of McDonald's and the corner liquor store. Meanwhile, the city and the local redevelopment agency promoted a package of incentives to encourage new, healthy food retail to come into the neighborhood. The fact that this was so targeted was really controversial. On the one hand, it was designed to change an environment that was most calling out for change. On the other hand, many thought that it was really paternalistic, telling a particular group of residents what they could or couldn't eat. There's an easy answer to this, but Los Angeles weighed the pros and cons and determined that a targeted strategy was necessary if the city was really going to take disparities in access to healthy food.
Yes, I think a very important part of the story here is that there were many local advocacy organizations, including Community Health Council, who organized residents, and residents had identified the lack of healthy food as a major problem. And they had gone to their local elected officials. They found champions on the city council who really stuck their neck out on this policy. And the policy was adopted because the residents wanted it. The moratorium was coupled with the coordination of existing access. I'm so sorry to be the policy we're talking about, which is the moratorium, really had the backing of the local community. And having those people organized and ready to go to city council, I think really cut and undermine the argument about paternalism, because it was the residents themselves that were saying they needed more healthy options. Additionally, the city began to target existing assets like planning and economic development assets to bolstering the number of healthy food options in that community. And so it was a real win, and it was grounded in the community organizing that went on.
Yeah, for that, Charlotte. In fact, I actually just read that the LA City Council voted to make that moratorium on fast food permanent.
Yeah, and it was because of the support and advocacy by community residents and organizations and the existence of champions on the city council who were able to get those votes.
Okay, I'll admit it, I'm a data geek, so I love this next one. Tell me more about how data can help make great policy.
Data too, and it can really help you prioritize the needs of the community and make the case for your policy. If possible, it's important to conduct a survey of existing conditions before passing a policy in order to tailor the policy to your community's context. Here's Kentucky. In 2008, the city decided to make itself one of America's most walkable cities. Concerns about health and the environment among residents, along with low walkability rankings from national organizations, prompted the city to think seriously about improving sidewalks and trails. It started by convening public meetings to gather input from citizens. They conducted surveys of residents and business owners in the city and convened city and county agencies whose work touched on mobility and street infrastructure. This preparation led up to a pedestrian summit, which brought together stakeholders to discuss and prioritize ways to improve walkability. All of these data informed a walkability plan, which has guided the city's work to improve sidewalks and other pedestrian infrastructure ever since. In addition to gathering input from community members through surveys and meetings, we went on walks with community members. Simple idea. There, they conducted walkability assessments, identified and prioritized specific areas where sidewalks and other pedestrian features could be improved. The city could have relied solely on national data and standards to identify the pedestrian infrastructure that needed improvement, or could have prioritized projects secretly behind closed doors with little input from the community. Instead, the city opened up the process to the people, the pedestrians themselves, and let them play a major role in identifying where resources should be focused. Work is still underway, but their extensive data collection and open process will almost certainly yield better results for pedestrians than a less context-specific process.
Yeah, I want to say from our experience in California that local policymakers are very interested in local data. And in answering that question early on, should we start with policy? I think the interest of local policymakers in local data, they want to know what's going on in their community. I think this is a great opening for a relationship and conversation with those who are in the position to make policy. When we surveyed California cities, and there are 485 cities here, and again, I said most of them are under 100,000. When we surveyed them in 2008 and then recently in 2010, assessment was a topic that the vast majority of our respondents were interested in. So again, they really want local data and they're willing to learn how to gather it. And you might identify your local champion, that person, and offer to work with him or her on figuring out how to gather local data. That might be a place to start the conversation. In California, our health departments gather and publish local data, both at the county level and often at the city level. They're a critical partner, and I imagine that you have a similar partner in your community that you might be able to turn to get some of this local data.
And I think one more thing that we wanted to note on this point was that, you don't need the most fancy and sophisticated data. University-led research will be of interest. The important thing, though, is that your community's unique conditions and characteristics are captured, and use what tools you have available to collect that information and make sure that it gets into the policy development process.
Let's see. Our next element is about changing the conversation. So when we talk about the obesity prevention conversation, we often hear that individual choices and not policies will fix the problem.
Common argument that I'm sure everybody on this call today hears every day. A strong obesity prevention policy, though, will change the conversation about the cause of the obesity epidemic from an individual focus to an environmental focus.
I totally agree with you. I think that that's the place we are in our movement to address obesity, and that the environment is the key. However, I just really want to emphasize that in order to move to that focus, to move from the individual to environment, we actually do need to acknowledge the role of the individual. And this is really different from the tobacco movement where I have some roots, that when we're having conversations and people are talking about individual responsibility, let's acknowledge, yes, people do have an individual responsibility to make a healthy choice. However, they need to be able to make the healthy choices. If we acknowledge the role of the individual and then move to the environment, those folks who are still in that kind of mindset about the individual responsibility will be able to make that make that leap with us. And one of the things that I do is I tell stories to get this point across. And one of the stories I tell, I'll be real quick here, is that I talk about the single mom, lives in Richmond, California, works 2 jobs, and how maybe when she went to get her food stamps, she's learned about healthy choices, and she really wants her children to make healthy choices. However, her first responsibility is for the kind of safety and welfare of her children, and so she doesn't let them play outside because there's violence happening in the streets, and she's a good mom, and she tells her kids that they can't go outside. You know, she probably goes to the fast food restaurant and feed a family off the dollar menu a couple of times a week because she needs to feed them and her income is limited. So she wants to make the healthy choice. She's being a good parent in making the quote-unquote unhealthy choice because there are no healthy choices in her environment, and what we need to provide for her are healthy choices. I think storytelling is a really good way of getting this across.
I think that's a great, compelling angle. So I'll give another example here of switching from the portrait to the landscape. We recently had a front row seat to policy public health debates regarding kids' meals. Until a few months ago, the public health discussion of fast food marketing to kids was largely confined to billboards and television commercials. And most American parents probably never thought too much about that age-old practice of giving away toys with kids' meals. Finally, a county in California adopted legislation that prohibited toy giveaways with unhealthy kids' meals. The sponsor, Ken Yeager, put it as the nation's first ordinance preventing restaurants from preying on children's love of toys to peddle unhealthy kids' meals. Pretty powerful language there. This is just the beginning of a whole new conversation about toy giveaways and kids' meals, and this practice that most people never even thought of as marketing. What was the response from not across the country, but from around the world? Since Santa County's bold, conversation-changing action, San Francisco County has continued the conversation, implementing its own ordinance prohibiting toy giveaways with unhealthy meals. And many other communities have expressed interest in similar legislation. Our colleagues at Berkeley Media Studies Group say that communities can use policy as a vehicle to shift from a portrait to a landscape, expand the conversation about health from a narrow focus on individual responsibility to a wider focus on the environmental landscape and social norms. This conversation applies to many obesity prevention policies. For example, and this is going back to Charlotte's example, a lot of people say that parents just need to kick their kids out of the house and make them play outside. That's the portrait view of the problem. When you shift to the landscape, you see that many families live in neighborhoods where they don't feel safe to play outside, either because of crime or a lack of open space and safe sidewalks. Think about how this change in a frame can apply to the policies that you're working on right now.
On to our ACE element. It's part of a bigger plan. Does that mean we need to ask ourselves how any one individual policy fits into real community change? Is the joint use agreement really going to ensure kids get their exercise? Will decoupling toys from junk food lead to a slimming down of our nation's children? Will a cent tax on a can of sugar-loaded beverages cause a run on tap water?
Between me, it's just us on this line, right? The answer is no. When you consider each of these policies in isolation, policies need to be a part of a bigger plan. When thinking about obesity prevention, we're really talking about very fundamental aspects of how we live our lives, like diabetes, asthma, traffic injuries, social isolation, and pollution. Obesity is a symptom of a larger problem with our culture and environment. So solution has to be part of a bigger plan.
Yeah, and I will say with absolute certainty that policymakers want to be part of the solution for them, and the policymakers are our targets because they are the ones who are going to make the policies that are going to change the environment. And the solution is these smaller pieces that can accomplish when they are in office. And they run for office because they care about their community and they want to make it a better place. Regardless of party affiliation, they want to make their community a better place. That's why they ran. They didn't run for office to slash budgets, and they certainly didn't run for office to make life worse for the younger generation. So moving forward on policies, and we talked about no and low-cost policies, we're just now talking about smaller pieces of the larger solution. Move forward on policies that get at these causes of obesity is something that they want to do. When one or two changes at a time is politically feasible and it makes people feel good and it makes a difference. I think part of our role as advocates is to hold the big picture, be working on this for the rest of our lives. But we also have to be realistic about the pace of change. The obesity epidemic came about over several decades, starting with this post-war land use pattern of suburbia. So it's going to take as long to get out of it. So I think we just need to hold that in our mind and be patient and just work at it one step at a time.
Part of what we try to do at PHLP is identify the links among all of these issues and build bridges between the policymakers who can jointly have a profound impact. Planners often don't understand the work of the public health department and vice versa. Regional development agencies don't understand the work of parks and rec departments, vice versa. Collaboration among policymakers around health and all policies can lead to great change, not to mention more efficient use of community resources. And there it, the 8 elements of a strong obesity prevention policy. If you're working on this in your community, think about whether your policy is a program or actually a policy, if it's legally feasible, if financially feasible, implementation is clear and feasible, a lot of feasibility going on here, it accounts for disparities, if it's data and context driven, changes the conversation, and make sure that it's part of a bigger plan.
Okay, now it's time to take questions from the audience. My first question comes in and for Charlotte. Charlotte, in your experience working on actually passing and implementing policies, do you feel there are any important elements missing from this list?
I do, and actually we've been talking about it here because I think Christine has also gotten some feedback, and that's the element of political feasibility, and I mentioned that in my last comments. Political feasibility can be looked at from a number of points of view. From the community point of view, from the advocate's point of view. The policy needs to be something that's deeply felt, it's widely felt, a lot of people feel really strongly about it, and it needs to be winnable. And this comes from community organizing practice and theory. We want to win. We want to make change. We want to be successful. We do not want to go out of the gate with a policy that's not going to fly in our community. Giveaway ordinance that we talked about in Santa Clara and San Francisco, that was politically feasible there, but it's not politically feasible in most parts of California and in most parts of the country. It's because not a lot of people care about it, and it's not going to be winnable. So from that community point of view, what does your constituency really care about, and what's going to be winnable in their community? And that gets to the policymaker piece and what's politically feasible from the policymaker's point of view, from the elected official's point of view. As I said before, you really want to identify a champion someone who you can work closely with. Maybe a champion is someone that you start the conversation by talking about assessment and local data, and then you move forward to really work with that person to fashion policies that can be brought to the larger council, the county board of supervisors. That champion has to be able to get the votes to pass the policy. It's a very practical thing. In California, most city councils have 5 people. Your champion that you're working with needs to get 3 votes. For the champion to persuade at least 2 others to vote for your policy, it's got to be politically feasible. So I just really want to emphasize that piece as well, and really emphasize the point that we want to win. We want to make these small steps towards this big picture. And assessing political feasibility, I think, is something that's very important, and certainly something that's very intuitive for all of you who are listening into this call.
Thanks. Another question came in that was about whether policies that we're talking about today have been evaluated for their effectiveness. And this is a question that I think the public health community is interested in, partially because we want to make sure that we're actually passing policies that make a difference in the health issues that we care about, but also because I think there's an expectation that we're only going to go after policies that we know will work. Christine, can you respond to that and talk a little bit about how you discuss evaluation of effectiveness when we talk about policy?
The prevention movement is relatively young. It's as compared to, say, the tobacco control movement, and therefore there hasn't been enough time to do extensive evaluation of all of the policies that different communities and states are trying out. One means that we shouldn't pass them or shouldn't try to get them implemented, because the obesity epidemic is moving fast and the obesity rates are growing. So we can't just wait around until we have perfect data. Also, it's important to recognize that we need evaluation data from the real world. And so if we evaluate policy ideas in abstract without seeing how they work in practice, we won't learn how they're going to work in environments that people are living in. We're seeing a lot of evaluation data coming out right now about menu labeling laws that require restaurants to put calorie counts on menus and menu boards. And those initial policies were passed at the state and local level a few years ago, so that's why we're sort of just now seeing data coming from that. And we've learned a lot from that evaluation data. For example, we've learned that people need to know the context in which those calorie counts reside, so that a person's diet should be 2,000 calories, and therefore a hamburger that has 500 is, a certain proportion of that total diet. So we can learn a lot, and then we can, change the policies that we have on the books based on what we've learned from evaluation. So overall, we don't have a ton of evaluation data, but that doesn't mean that we should just stop and wait for that.
Thanks. I saw a question about how to involve low-income communities in policies that promote walkability, and I'd like to respond to that one. That's a great question, and I think you heard us kind of talking about this issue over the course of today's conversation, where in communities where there's concerns about crime and personal safety, walkability, bikeability may not be the top thing that communities are asking for. However, my experience, I think actually work on crime and safety issues through or in combination with walkability and physical activity promotion can be a great paired strategy. So, for example, crime prevention through environmental design, that has the acronym SEPTEN, I'll write that up for people, is a strategy that combines kind of natural surveillance, making sure there's eyes on the street, designing so that you're conveying feeling safety and perceptions of safety, designing spaces that are less likely for people to feel unsafe and for crimes to be committed. A simple example of that is if you're talking about a community that has really poorly lit sidewalks, sidewalks or has lighting that's designed only for cars, you really have an area where it's going to feel unsafe for pedestrians to walk. Making a change in lighting so that it's pedestrian friendly has a safety impact, and it also has an impact on physical activity. Thinking about that, where communities are coming from when you put together a policy and working on those root issues is really important. I've got a question here that I'm going to combine together, and it's a question about how to get started in a conversation with policymakers, as well as how do you approach the issue of obesity with policymakers who may themselves be dealing with obesity or overweight. Charlotte, can you talk about that?
Yeah, I'll talk about both of those, and I think both of them are very important. In terms of getting started, I think that you should do a little bit of research on your policymakers, and you could do that by going on the city's website and looking at the bio of your policymakers, or the county website, whatever policy realm you're looking at. You could also talk to people you know and in your community, because you know the elected officials. And once you know something about the policymakers, choose one or two who you think you have something in common with. It could be that both of you go to the same church. It could be that your kids go to the same school. It could be that you know that they walked in the American Cancer Society Walk for Life. Those kinds of connections are very important. And then you want to set a meeting, and usually you call into the hall or county office and set up an appointment, and then go and take several people and just begin to talk about why you're concerned about the issue that you're concerned with. I think you might want to take a little bit of local data and just really have the conversation, begin the relationship, and start to talk about what you have for the community and where you want to go. It's a one-to-one thing. We've really learned that in our work. One-to-one face-to-face communication really makes a difference. So that's how I would start with that. Now, the next thing in terms of being sensitive to the fact that policymakers come in different shapes and sizes. One of the things, and we've had to practice this, and we've actually done role plays around this. I think one of the things that we really want to talk about up front is that the issue of obesity is a concern because obesity leads to chronic diseases, and those chronic diseases create a lot of suffering for individuals and families. And they lead to shortened lives, and they cost a lot of money. But people aren't, what we really try to do is talk about how it doesn't really matter what shape or size people are. People who are heavy can be healthy, and people are heavy sometimes because they're doing exactly what the environment is telling them to do. The marketing of junk food, the way that cities are designed, et cetera, et cetera, et cetera. If any of us take those cues and just go along with the program and what we're supposed to do, we are going to be heavy. It's an obesogenic environment. It's a toxic environment. So that we're really talking about environment, we're talking about changing the environment, and also talking about creating a healthier environment for our children. And use that that phrase and that statement that came out of the Surgeon General's office, maybe a Surgeon General, someone's office, that for the first time in our history, the next generation is going to live a shorter lifespan than their parents. And we use that a lot because policymakers want to do, as I said before, they want to improve the community, and they want to improve the community for their children, for their children, for their nieces and nephews. And it's not the American way to have the next generation have a worse life. People to this country in order to create a better life. That's the legacy of this country. And so I think emphasizing those kinds of things, making it really clear that you're not talking, when you talk about obesity, you're not talking about the person in front of you. You're talking about the environment that has created this problem. That will go a long way to opening the doors. And we've a lot of elected officials admit that they have a weight problem. We've seen elected officials take on weight loss, and Mike Huckabee in the South. So those are some of my kind of points that I've learned as I've worked on this issue.
Thanks. I have another question here from someone who wants to know just what is a resolution. And I'm wondering, Christine, can you talk a little bit about the difference between some of these words that we throw around that all kind of sound like they're policies, but maybe what the difference is between a resolution versus an ordinance, et cetera?
Policy, like I said at the beginning of the webinar, comes in a variety of different types, and lots of different terms are used to describe policy. We have gotten a few questions about what exactly a resolution is, and so, I think most of us are familiar with laws that are passed by our local government or our state that require something to happen. Like, I live in San Francisco, and grocery stores are prohibited from giving away plastic bags with your purchase anymore. That's a law. It's required. Grocery stores must follow it, or they'll, be subject to some kind of penalty. That resolution is different. It's not. It doesn't create binding law, but it is still a policy tool that can be used to accomplish a lot of different objectives. They're considered more informal than ordinances or laws, and they're often easier to enact. So a local government could use resolutions to set internal policy. They could use it to direct internal operations. Often they're used to make a statement of support or opposition to a particular issue, or to encourage other branches of government that maybe the legislative body doesn't have control over to take an action on a particular issue. So PHLP actually has some resources on resolutions if this is something you're interested in. We have an obesity prevention local resolution. It's a model policy where you can fill in the blanks and tailor it to your community, and it sets out particular statements of support and objectives for a community to take as they work towards reducing obesity rates and improving the health of the community members. So I encourage you, there's a whole fact sheet on why an obesity prevention resolution might be right for your community, and then you can check out the resolution language on our website.
There's another question that came in, and I think this is a great question, about the effectiveness or use of qualitative versus quantitative data. So when do you tell the story versus when do you use the pie chart and bar graph? Actually, it's interesting because in my experience, you often need to use both. In fact, studies show that different people respond to different kinds of data differently. So for some people, qualitative data is going to be much more persuasive for them than quantitative data. Other people respond more to quantitative data and tend to put qualitative data into the category of, well, that's just an anecdote. So I think if you're really going to be effective in using data in your work, you need to think about ways to bring both kinds of data into the story, into the picture. And again, to emphasize a point that we made earlier, even quantitative data can be simple and straightforward. It can be data that, you're asking partners to help you collect. It can be local surveys. It can be data that you pull from, some of your partner organizations that you might be working with. I'll say, from experience, one of the most important things to do when you decide you're going to use data for something is actually internally for yourself decide whether the kind of data you're using is qualitative or whether it's quantitative. Sometimes, in the worst case scenario, you start a process and people actually aren't sure, are we collecting information to tell a story, or are we collecting information to be able to, create a statistic? And obviously, different kinds of techniques are going to be more effective in collecting and presenting both of those two kinds of data. Okay, another question here that's about getting to implementation. So if a community has already gone through the process of prioritizing, of identifying and prioritizing a policy, how do they actually take the next step and where does the rubber hit the road, as it were? Christine, do you have a response for that?
And I will use this as an opportunity for a shameless plug for public health law policies, resources. If you've identified a policy idea that you're really interested in pursuing, check out our website because we have a lot of tools that can help you take that next step. We have model documents that provide sample, strong legal language in order to implement your policy idea, and we have these in a variety of different topics. We also have a lot of fact sheets and other basic informational documents that it might explain things that you already know, but they could be a useful tool for you to download and print out and take to your local elected official or to an agency official in order to explain certain ideas and convince them of your ideas. So I would just encourage folks to check that out. And of course, we're here and available to work with you on crafting language that works in your community. So definitely reach out to us if you have questions about specific ideas.
Add to that, I think that once you get to the point of having the policy adopted, generally speaking, implementation will be delegated to one aspect of the county or city government. And I think as advocates, it's incumbent upon you to make sure that the office or the person to whom implementation has been delegated is actually creating a timeline, etc. But generally speaking, government entities have a lot of experience implementing policy, and so they will know the steps for implementing the policy. I think you just need to make sure you're staying on top of that. And if that's not happening, you may need to go back to the policymakers at one of their meetings or privately work with your champion, talk about why it's not happening. But once the policy is adopted, whether it's the ordinance or the regulation or the resolution, you've got some ammunition there to push the entity that's been delegated responsibility to actually implement the policy.
Heather, on mute.
Sorry. That was a great point, Charlotte, and thanks, because we got another question about how you actually can make sure to push forward a policy that's already been adopted by a body. I have a question for Christine that is, I think, referring basically to one of the policies that we talked about for revenue generation, which was around sugar-loaded beverage taxes. And the question was about how you can, or if there's examples of policies that generate revenue without being a regressive tax. Christine, we get this question all the time, and I'm wondering if you could talk a little bit about that.
That's a really good question. It does come up quite a bit, and a lot of people are making the argument that sugar-sweetened beverage taxes are aggressive because they make up a greater proportion of low-income people's expenditures than they do of higher-income people's expenditures. And I think probably the best response that I've heard to that is that the low-income communities are most affected by the obesity epidemic. The obesity rates do tend to correlate with income and socioeconomic status. So these are the communities that the public health is most concerned about. Second, it's really important to earmark the revenue from a sugar-sweetened beverage tax for obesity prevention efforts. And to take that one step further to address this regressivity argument, it would be great to take that revenue and redirect it back into to the low-income communities that are most affected by obesity. So redirect that money to attract grocery stores into underserved communities, to pay for those double SNAP programs where food stamp dollars are doubled at farmers markets. Use it to improve the communities that are most affected by obesity and therefore, need more access to healthy food and need less access to junk food.
Christine, just as a quick follow-up question to that, I'm wondering if you know of any resources for people that are interested in looking at a map or a list of communities that have passed sugar-sweetened beverage either fees or taxes?
Yeah, so one thing to note is that there is a state or locality that has passed a new sugar-sweetened beverage excise tax or fee thus far. A lot of states and localities that have introduced sugar-sweetened beverage tax legislation and have gotten pretty far with them, but it hasn't passed yet. We have put together a chart of excise tax legislation that breaks it down by different provisions to compare the different ways that states are drafting sugar-sweetened beverage tax legislation. This chart isn't available on our website, but if you email me or follow up with us after the presentation, I'm happy to share that information with you.
Great. There's a question, kind of a related question to the question I answered before about dealing with gentrification when you're on policies, in particular that improve walkability or bikeability in the community, but actually I think a range of the policies that we've talked about today actually have potential for basically pushing for gentrification in a community. For example, if you're working on a policy to improve grocery store access, and that new grocery store sort of creates pressure in the neighborhood for increased rents, that could be a policy that has that unintended consequence. And I think this is actually a big area for all of us who are interested in working on obesity prevention to consider, that policies that deal with or tackle obesity prevention may not be dealing with this issue of gentrification in and of themselves, and you may need to work with allies or pair your policies with other kinds of strategies that may not directly tackle obesity, but that have an impact on low-income communities and on maintaining quality of life and improving quality of life, specifically for low-income communities or those who are experiencing health inequities. So, for example, one of the areas of policy that people talk about when they talk about gentrification is housing policy and making sure that you are preserving and promoting affordable, mixed income and low income housing when you're working in communities. That kind of a policy, combined with a policy that's working on improving the pedestrian or walkability infrastructure in a community, is combative to those pressures of gentrification and hopefully makes sure that the communities that are benefiting from this new transformation and revitalization in the community are those who were there before the policy was in place. We've come to the end of our webinar. We've taken questions from you in the audience. There are a few questions that I think we didn't get to, and we can try and follow up with folks who had questions that we didn't get to over the course of this webinar. But I do want to make a plug for our next webinar, which is going to be on using economic development and redevelopment strategies to revitalize communities while increasing access to healthy food. And of course, you can register online for that webinar at our website, which is www.phlpnet.org. That's also the portal to finding many of the resources that we mentioned on today's call. I also want to thank Charlotte and Christine for joining us today. And I'll go ahead and turn it over to Christine for a final thought.
Thanks, Heather. You probably have a stack of obesity prevention policy documents on your desk right now. I know I do, and it probably looks like this, and you probably feel like this person who's hiding behind a computer. These reports have long lists of ideas for how to improve access to healthy food and physical activity opportunities, and it can be overwhelming. But hopefully the list of 8 elements is a good starting point for you to whittle down the list to a handful of really strong policy ideas. If you need help assessing your policy options, or if you need help crafting strong policy language for your community, don't hesitate to contact PHLP. We are total policy and law geeks, and we love to chat with you. Thank you all for joining us, and have a great day.